Welcome to the Winnebago County Community Mental Health Board Program Year 2023 to 2024 New Applicants Grant Seekers Information Session. If this is your first time applying for grants, or if not, I recommend that you check the Winnebago County Mental Health Board's funding resource page, which is listed at the URL below. And you will see numerous funding resources available to you on that page. There are three critical documents that I certainly recommend that you review. First is the Notice of Funding Opportunity, which outlines all of the requirements for this year's grant program. The Strategic Plan, which dictates how the Mental Health Board makes their funding, and then also the funding policy. So as I mentioned, the Notice of Funding Opportunity outlines who is eligible for funding, which includes nonprofit organizations, for-profit businesses, including sole proprietorship and LLCs, hospitals and healthcare organizations, including federally qualified health centers or FQHCs, and also government entities, including departments within Winnebago County government. In order to be a lead applicant on an organization, meaning the one that actually is filing the application, being the fiscal agent for the program, you must have been in existence and show evidence of being established for at least 3 years prior to your application for funding. Here you will see the timeline of critical deadlines. This year, there has been a change in which there will now be an abstract round for new applications, followed by full applications for those who are selected after the abstract round. So the Notice of Funding of Opportunity was published December 8th. The application portal opened December 12th. There are grant seekers meetings December 13th and December 15th, for which pre-registration is required. You can find the link for registration on the funding resource page. And once those question and answer sessions have taken place, links to those recorded videos will also be on the funding resources page. The deadline for abstracts, which are abbreviated and fairly simple to fill out, will be January 18th. The board will then review abstracts and make decisions about whether or not they would like to receive a full application for that particular proposal. Then the full applications will open, the portal for those will open March 1st and will close May 3rd, with final funding decisions made by the board on August 2nd. Because their decisions will be past the traditional program year start date, new applications this year will be on an abbreviated 9-month year for year one, and then it will extend. Renewals will be on the same timeline next year as everyone else, if renewed. The strategic plan by state statute, the Community Mental Health Act, is what mental health boards are required to complete every 3 years in order to dictate how they fund services. The Mental Health Board has adopted the community support system as their conceptual model for funding. The basis of this is to develop an array of services that allows for individuals with mental illness and substance use services to live and recover in their community. There are 6 priority areas that are identified in the strategic plan that I will go over later that are all part of this community support system model, which are eligible for funding. So as I mentioned, priority tables, there are 6 of those kind of spokes of the wheel, you might say. That includes mental health treatment, case management, crisis response services. I will click to the next slide and give you the other 3 in a second, but I also want to detail for each priority area, there are specific types of services which are detailed in the strategic plan, target populations for which there are definitions in the strategic plan, and then there are types of outcomes that we would like organizations to detail what outcomes are most appropriate for their program that you might intend to see as a measure of success, both in the systems capacity outcomes and individual and family outcomes. Community outcomes are something that the Mental Health Board will attempt to track over time to see community-wide impacts. The additional of the last 3 of the 6 priorities include family and community support, client identification and outreach, and also housing. So the funding amount for this particular program year is up to $20 million for covering both new and renewal programs to cover the 6 priority areas and the target populations, which is essentially children from infancy all the way through adults for both mental health and substance use. There are opportunities to collaborate with other organizations in 2 different ways this year. Number 1, your organization can sign up on this collaboration interest sign-up sheet on the funding resource page, and you can try to find other organizations that you want to do a co-application with or a partner application. Of course, one agency will have to be deemed as designated as the fiscal agent for the project, and everyone else would be considered either a subawardee or contractor. So that's one way that organizations can find each other and maybe self-organize or self-coordinate a collaborative application. And a second way is through use of a referral and resource sharing technology platform called IRIS. And there will be a link to an information session on the funding resource page that will have a great demonstration of IRIS with some questions that were from community members and community organizations during a recent information session, sharing about IRIS and kind of detailing how that gets utilized by agencies. The funding policy is what details kind of like the eligibility requirements and some other requirements for funded agencies and how the board makes funding decisions. Eligibility, as I mentioned, you have to have been established for 3 years. There are a list of disqualified organizations made on the basis of mental health board member affiliation. So if a mental health board member is an employee or a board member of an organization, they are disqualified from applying for funding to the mental health board. If you are an agency looking to apply for funding and you see that you are on the disqualified agency list, you should contact the board member who is listed as the person who is affiliated with your organization to let them know of your intent to file for funding. Administrative requirements are detailed in the funding policy. I'm only going to highlight a couple of those. One is that services that are funded by the mental health board may not be denied based on a client's inability to pay. And secondly, organizations that are funded by the mental health board are required to participate in a learning network collaborative group, which is all of the funded agencies meeting together to discuss coordination of services. Fiscal expectations, you may elect a 10% de minimis indirect rate, and you do not need to provide any documentation for that. If you are electing to take a higher than 10% indirect rate, you must provide a state or federally approved indirect approved agreement, and you must follow all of the guidelines in that agreement, including how that agreement dictates that cost allocations are done for direct cost allocations. If you are doing a collaborative application, the fiscal agent is responsible for making sure the fiscal expectations are met by all partners. There are 2 different ways to do fiscal agency. One is that the fiscal agency can essentially contract services, and in that case, it must be done in accordance with the funded agency's, the fiscal agent's procurement policies. Whether that requires an additional RFP or not could be dictated in those procurement policies. In a partnership model where it's not contract, subawardees may complete their own independent monthly budget sheet that shows expenses and revenues and submit all of their own evidence of expenses. That's a little more complicated to do, but it is a possibility for collaborative applications. And in those cases, we do ask for all of that evidence to be submitted by each partner agency separately, so we can easily distinguish which line item in the budget relates to each organization. Lastly, as it relates to the decision-making process, it will be 3 board members who review each grant application and score them, and then those scores with any comments will be presented to the entire board for review and discussion prior to making funding decisions. Grants are expenditure-based grants, meaning that approved expenses are able to be reimbursed on a monthly basis. So we do require on a monthly basis that funded organizations submit a reimbursement request detailing any revenues generated as well as their expenses, and they will be reimbursed for approved expenses in excess of revenue. These are year-to-year contracts, so 1-year contracts. In this case, for the first year, it will be a 9-month contract, and renewal is a possibility, but it is not guaranteed. Decisions are made annually. It is, however, the intent of the board to continue successful programs in order to maintain continuity of care. If contract amendments need to be made during the year, which they can be, any work plan amendments can be made by the board president, and any budget changes must be made by the full board. The board president may also ask for a full board review on work plan amendment or other contract changes if the board president deems those to be significant changes. As it relates to reporting, there is a quarterly and annual reporting requirement. For quarterly reports, we require program outcomes, which will be developed with the organization. Staff will help with developing those with the organization, and those will be reported on monthly, as well as numbers served within each target population group, a breakdown of numbers served by demographics as the organization collects their demographic information, and lastly, a qualitative component that reflects on organizational learning and stories of success. Lastly, there is financial reporting requirement. Again, I mentioned this before, that happens on a monthly basis, and we operate on the principle of best evidence. So we try to work with each organization to get the best evidence that you can submit for each piece of evidence for each expense. As it relates to the fiscal reporting requirements, your program can become very complex, or it can be very low in complexity, kind of depending on the nature of whether or not the program is generating revenue and also how the staffing is done. So when at its lowest complexity, programs that do not generate any other revenue, it's just sales tax funded only, and all of the staff on the program are dedicated, there is a very low amount of evidence that is required. You can essentially just give us a signed statement each month that all of that time from the staff was spent on that funded program. They were dedicated staff, and any invoice of expenses for other items like supplies or equipment. When a program is revenue generating, such as there are components of the program that are reimbursable to a Medicaid, for example, in a fee-for-service model, we do require that you report that revenue to us. and then we will reimburse you for expenses in excess of revenue. And then when there are staff working on the program who also work on other projects or programs, so they're not completely dedicated to this program, we do require you to keep timesheets and submit those each month to show how much time that staff spent on this particular program. I will now turn it over to my colleague, Nicole Bennett, who will go into the actual application with you.
Hello, my name is Nicole Bennett. I'm a licensed clinical social worker hired by Region 1 Planning Council, and I also provide support to the Mental Health Board in regarding grant making. So for grant application, we use a portal called Found It. Here is the link. You can also find it on our website. If anybody needs assistance in creating a new account or has any issues accessing the portal, please feel free to reach out and we will share contact information at the end of this presentation. In regards to the application process, this flow chart is also on our website. So as Jason previously mentioned, this year we're doing an abstract application. We're very excited about this. It's just a few questions, kind of your elevator pitch or your vision for your program. The board will receive those abstracts by January 18th and evaluate them. There's kind of a red, yellow, green process for that. So green being receive application, and you would complete a full application. Yellow would be receive an application with some modifications. So those modifications would be relayed to you. You'd be able to complete an application, a full application with those modifications, and red would be not receive an application at this time. If you're selected to complete a full new application, you would do so and the board would evaluate that, and we'll kind of go over the rubric for that, and then a funding decision would be made. So in regards to the abstract, the board's going to review your proposal description and estimated total budget, do the best you can on this aspect, target populations you're hoping to serve, funding priorities that your abstract is seeking to meet, identified funding gap you're hoping to fill, and any abstract proposal must be evidence-based, best practice, or promising practice. All of these definitions are also on our website for your reference. The abstract also needs to be in alignment with the strategic plan, so that will be evaluated, any safety concerns, and then how effective your total budget is. A board may also suggest program modifications, which I previously mentioned. So in regards to new proposals, an environmental scan was done. We have it called the environmental scan 1.0. So that was done in order to figure out what gaps existed in our community and what populations needed to be served. So in the first year, programs were funded, the second year programs were funded, but in this third year, the board is really seeking to fill those gaps in and be able to fund programs to assist individuals that haven't maybe been met yet. So the 7 areas that we have are eating disorder treatment, harm reduction or low income detox services, infant and early childhood, older adults, substance abuse use in regards to family and community support, supportive housing for youth, families, adults, and seniors are also included in this funding gap, and then youth crisis services ages 5 to 17. So for abstracts, we're seeking people to address these areas that have already been identified as funding gaps. However, we also have an other category. So if you are seeing a funding gap or a barrier that you know exists in the community, you are able to select other. However, it would be your responsibility to be able to provide research or evidence as to why this is a funding gap and how you best seek to address that gap. So in regards to the funding gaps, you will also find more information, resources on our website in relation to treatment modalities or different aspects about those funding gaps. In any questions that anybody has, feel free to reach out to info@mentalhealth.wincoil.us. Also, our website is listed here. You can sign up for our email list so you can have the most up-to-date information and to be able to reach us here on social media as well.